Good afternoon, everyone, and welcome to the second session of the Alliance for Health Policy's Voices from the Frontlines signature event. My name is Dr. Reed Tuckson, and I have the honor of being the chair of the board of the Alliance for Health Policy, and I also am a co-founder of the Black Coalition Against COVID. I'm pleased to be with you here today to moderate the next two honoree categories, those for community engagement and for public health. Among the most important lessons we have learned from this pandemic is that there is an enormous importance of trusted community leaders. These community leaders' role cannot be understated as we seek to advance better health for all. To bridge the gap in health inequities that have become even more stark during the pandemic, individuals and communities across the country have stepped up to provide leadership, trusted information, practical support, and they've worked hard in many cases to make sure that community voices are being heard in the halls of power. To recognize their efforts, I'm pleased to introduce today's community engagement honorees. Our first honoree in the community engagement category is Dr. Lisa Fitzpatrick. She is a medical doctor and founder of Grapevine Health, and I'm also pleased that she's my colleague as a founding member of the Black Coalition Against COVID. Dr. Lisa recently spoke with the Alliance CEO, Sarah Dash, about her Dr. Lisa on the Street series and her passion for sharing trusted, understandable health information. We have a brief video of their interview, and so let's watch it now.
Thank you so much for joining us today, Dr. Lisa. We're so pleased to have you as one of our Voices from the Frontlines community engagement honorees. Dr. Lisa Fitzpatrick, fondly known as Dr. Lisa, is the CEO and founder of Grapevine Health, a digital health media and patient engagement organization working to improve access to trusted health information in Black and Brown communities. An infectious disease physician and CDC-trained medical epidemiologist, Dr. Lisa has held several leadership positions while at the CDC, including U.S. diplomat for the Caribbean region, and previously served as Chief Medical Officer for DC Medicaid. Seeing the need to bring easy-to-understand health information directly to people, she started the online video series, Dr. Lisa on the Street, which features herself and other medical professionals speaking directly with community members about common health questions and concerns. She's continued the series throughout the pandemic and has recently been traveling across the country to bring her Q&A sessions on COVID-19 to new cities and people. Dr. Lisa, welcome.
Hi, Sarah. Thank you very much for having me.
Thank you. And I'd like to begin with an opening question. You know, as a physician and as an epidemiologist who has the experience to really be in top leadership positions in both the private and public sectors in healthcare, what prompted you to create Dr. Lisa on the Street and turn your attention to that?
Well, it's a good question, and thank you for acknowledging my experience. It is true, but I love to be close to the community. I think we don't spend enough time listening to community and hearing what they need, particularly people who have interacted with the healthcare system. They have a lot of insight. So the best way to get it is to go where they are and to be proximal. So that's what draws me to the street corners.
Thank you. And what are some of the key takeaways? What are the lessons learned that you've taken away from engaging with people directly in their neighborhoods and communities, and particularly during the pandemic?
Yeah, so many learnings, Sarah. I know this is a short conversation, but I'll just give you maybe the top two. Number one, we have a lot of work to do to build trust with community. I think we're seeing during this pandemic how vital it is to ensure people have access to trusted messengers and trusted messages. I talk to people on the street every week who ask me some of the same questions we heard at the very beginning of the pandemic. What's in the vaccine? You know, is it going to kill me? People still are getting their information from social media, and the information is very sensational, exaggerated, and inaccurate. But if it looks sexy, it's hard to look away. So people are very concerned about getting the vaccine based on things they're hearing. So having a credible messenger right there with them on the street to answer their questions and tell them why they shouldn't believe the misinformation, I think it's really powerful. And so we use video. You might think, well, you can't reach too many people by just being on the street, but we use video for that purpose so that people across the country and even around the world can have access to these conversations and see, I'm not the only person who's confused by this. So we're enjoying ourselves.
That is so great. And obviously you've reached so many people. Do you have any stories about how your conversations have encouraged them to, for example, get a vaccine, or, has it actually changed the way that they think about healthcare?
Yeah, it does. We were in Mobile, Alabama a couple weeks ago, and a gentleman walked up to me and said he has a doctor and his doctor wants him to get vaccinated, but he doesn't trust the doctor because he thinks the only reason he wants him to get vaccinated is so that he can bill his insurance and get compensated for it. So he wanted my opinion. And I said, well, you have a relationship with your doctor. He said, well, I want a second opinion. What do you think? Mm-hmm. And, I'm humbled by experiences like that, because over and over again, whether it's virtual Ask the Doctor sessions or these in-person sessions, people are really trying to get to the bottom of this. Sarah, 20% of the people or so probably will never get vaccinated, but there are a lot of other people who really want their questions answered. And so this is why I'm so passionate about the work we're doing. We've seen people get vaccinated, dozens and dozens of people as a result of our work, whether it was in Detroit or Mobile, here in Washington, D.C., our virtual sessions. People call us back and let us know that the question and answer sessions or the access to trusted information has been impactful because it does lead people to get vaccinated.
That is so great. And we are so thrilled to honor your work with community engagement during this pandemic. And we hope we can get through it sooner rather than later. How do you see your work growing beyond the pandemic?
Oh, we have a big vision at Grapevine Health. We want to be the go-to source for trusted and relatable health information for Black and Brown communities. And, this pandemic is showing us more than ever why a mission like that or a vision like that is needed, but also possible. I think the more we tell the stories of how access to trusted health information does change behavior, the more we'll see traction and the more we'll see people coming to us for support. I think people are craving access to trusted, relatable, culturally appropriate health information, Sarah.
Well, thank you so much, Dr. Lisa. And we look forward to more conversations with you and hopefully with some of the people and the communities that you are engaging with every single day. And I'm so happy you've been able to join us as one of our Voices from the Frontlines honorees. We'll talk again soon. And thank you for all of your efforts now and into the future.
And thank you for honoring me. I really appreciate it.
Well, you are so welcome, and we'll talk again soon. And now I turn it back to our very wonderful board chair of the Alliance for Health Policy, Dr. Reed Tuckson, who has done so much to engage communities, and he is now going to join for a conversation with Deborah Fraser-Howes and Reverend Sheffield. Thank you.
Thank you so much, Sarah. And for those of you who want to follow Dr. Lisa Fitzpatrick, she's easy to find on YouTube and other places. Just put in Lisa Fitzpatrick or Grapevine Health, and you will be able to see so much of her work on video. Now we'll turn to our next two community engagement honorees. Deborah Fraser-Howes, who is my friend and colleague for many, many years, has been widely recognized. By the way, we were children when we first started. She has been widely recognized for more than 3 decades for her leadership to communities of color regarding teen pregnancy, social welfare, HIV, and AIDS. She currently serves as the founder and president of the Choose Healthy Life Black Clergy Action Plan, which fosters partnerships between Black churches and local United Way affiliates to conduct a massive COVID-19 public health campaign across 5 cities. Previously, she founded the National Black Leadership Commission on AIDS to combat the HIV/AIDS epidemic in the Black community. We're also pleased today to welcome and to recognize Reverend Horace Sheffield, who serves as pastor at the New Destiny Christian Fellowship Church in Detroit, Michigan. He also serves as the executive director of the Detroit Association of Black Organizations. That mission of the Association of Black Organizations is to build capacity of the community through vital resources and programs. Seeing gaps in the city's COVID response, Reverend Sheffield established free testing and vaccination sites across the city to better serve Black communities. I do believe that Reverend Sheffield may have had a technical problem in joining us today, and so we will continue our conversation with Deborah Fraser Howes, and she is aware of Dr. Sheffield's work, and so through her, we will come to better understand what Reverend Sheffield is all about. But Deborah, as the founder of the Choose Healthy Life Black Clergy Action Plan, help us to understand the lessons that you are learning about the role of Black churches in addressing the multiple challenges presented by the pandemic, and help us to understand what that role really is.
Thank you, Reed, so much. And thank you for having me. And thank you for this honor. It's really an honor and a privilege. And, you know, I always see you as my brother from another mother. So I'm thrilled to be here with you particularly. You know, the Black church has historically played a specific role in the Black community. They've always been the trusted voices. They feed the hungry, they clothe the naked, they've always taken care of the sick. They have been a force within, you know, people used to tell me when I was at Black in AIDS, you know, the gay men's health crisis, this organization, that organization started the first buddy system around health. And I tell them, oh no, the Black church has been doing call trees and buddy systems with their health ministries since the founding of the Black church. So it's all through slavery. And I understand from Africa. So it's not a new thing for the Black church to have a new role. They've always had this role, and they're just perpetuating the role that they've always had. So and what we've done with Choose Healthy Life with the United Ways is help to professionalize that role, to give them training from someone that you gave us, Dr. Clark, who's put together an excellent training program. We've brought together Dr. Tom Frieden from Resolve to Save Lives, who was Obama's former CDC director. And they've all come together to put together these training programs to prepare this brand new workforce in the community. And it has become a mighty force.
Wow. One of the things that I know that I have been learning from you is the passion for combining the Black church with Black physicians and other physicians of goodwill across the country. Talk a little bit about why you have seen that to be so important, that interrelationship.
It's, you know, it's critical. I'm going to tell you something, a story that happened a long, long time ago about the relationship between a clergy person and one of the medical doctors that were on my board and in Blacka. They were sitting together with each other, and the clergy, the doctor, was saying that he was having some problems with somebody from a cultural community specific to this pastor's community, and brought a baby in. This baby had some issues, and he couldn't really communicate well with the parent. And in a very short amount of time, the pastor was able to deduce that in this particular culture, was a Haitian culture, there were some things that were different that the doctor wasn't picking up. And he says, I keep asking her, I saw this high amount of mercury, and I keep asking her, you know, what did the baby have? And he said, why don't you ask her what she gave the baby to help the baby spiritually? And he did that, and found out that she was in fact giving the baby something that had mercury in it. And that's why he was seeing this mercury in the blood system. There is a yin and a yang between the medical community and the religious community as far as our community is concerned. Culturally, these are two people that we listen to. We don't necessarily trust a lot of Caucasian doctors. We've had some issues in the past, and for good reason, with Tuskegee and some other things. The government is, you know, very difficult for us to wrap our hands around. Not saying that we shouldn't, we certainly should, but there's something about the cultural affinity of having a Black doctor talk to you. He is me. She is me. We know each other. We understand each other. It's the same thing with the Black clergy. When I am dying, there are two people I'm going to. My doctors happen to be Black, and my pastor, because I want to know how to do the right thing to get into heaven. So I know he's going to give me the right information. And it is that understanding that basic. It's so basic for us that these two should be together.
And so the idea of, and what's so powerful is to have, while you on one level you have the Black doctor talking to you, then you have a Black pastor talking to you. But when the Black doctor or other doctors of goodwill and the pastors together talk to the community, now all of a sudden you got something powerful.
You got something powerful, because no disinformation can get through that. We're not listening to the disinformation at that point. Turn off the internet, forget about it. We're not in this noise. Right now, we're in this trying to save our own lives. And we've got sort of the Lisa Fitzpatricks of the world, who is wonderful and understanding and warm and compassionate. And we've got the Reverend Sheffield's, Reverend Butts, Reverend Sharpton. It is their role, the clergy's role, to be the advocate for the community. It is their role to be the drum majors of justice. We trust them because of that role.
The drum majors for justice.
Yeah.
One of the things that our policy audience, and so many of the people that are listening are policy leaders or staff, which are the leaders in Congress, because the staff people are the ones. But so many of the policy people that are looking in here will be interested, I think, in how you created the Choose Healthy Life. It is very difficult, I would imagine, to go from a standing start to creating something rapidly. And also, I would imagine that access to resources, particularly federal and state resources, must be also important. What was that journey like?
Reed, I think that God has prepared me all my life for this moment for some reason. Going through founding the National Black Leadership Commission on AIDS and running this not-for-profit for 21 years and growing it with the Black clergy, looking at how powerful they have been to get resources into the community, Minority AIDS Initiative, and all of the other things that I was fortunate and honored enough to do with them. And I know who they are, and I know what their power has been. And bringing in the Black clergy, working with the NMA, we've always been, I was honored to be a Scroll of Merit recipient to the NMA, because we have always worked with the NMA. So understanding that, and then going into corporate America, and going into the diagnostic industry, and then being retired for the second time, and at home watching them place Black bodies in the back of refrigerated trucks in Black body bags was too much for any one human being to handle. And I got up and said, we've got to, where the diagnostic companies, why are we having this problem with these testing deserts? And we were, lucky enough to get to Quest, and Quest decided to do a partnership with us. And I developed a program based on what I knew from my work at Blackup. We had the same disinformation, the mistrust, the same issues that were around for AIDS. It's the same issues that we had. Policy differences, nobody paying us any attention, no cultural affinity, just benign neglect. And we had to bring our people together that are our fighters, our warriors, our doctors and our clergy to move this thing forward. I was fortunate enough in this lifetime to see doctors in Philadelphia pick up the banner and just go out and start testing people with their own money. People all over the country, the same Black people that have been on the ground doing the work like you, Reed, are the same Black people that have come to respond to this pandemic. We've always been here. It was just a matter of somebody giving us the resources to do what we had to do. So we funded 50 Black churches in 5 cities. And now the federal government, thank God, has given us money so that we can expand to 120 churches in 13 states. We have become a force to reckon with. We have already vaccinated and tested over 50,000 people. We're out there every day. We're doing all kinds of 48,000 and change. It'll be 50 in a minute. We are out there fighting for what has to be done. And I believe that we have created a workforce on the ground that cannot be denied. People cannot say to us, other people are not able to break through and get into our community like we've been able to get into our community, because we are our community.
Exactly right.
And I think that that's important. And for people who have said things to me like, well, the government usually funds agencies that, that can be evaluated. How dare they? We've brought in Columbia University, the Malman School of Public Health, and a host of other experts, the Joy Collective, other experts, Values Partnership through you, blackdoctors.org. We've brought everything that we could possibly need to the table. We need help. We need the federal government to recognize who we are and to continue to fund this workforce. But we don't need to be told that we're incapable. That's why we call this Choose Life, Choose Healthy Life, out of Deuteronomy, to let our community know we have the ability to choose life over death. We don't need a whole lot of help. We have the resources that we need within us. We just need to pull those resources together and move forward and be a mighty force, no stopping us.
Well, I think it's a really important point, and I think it's not subtle. And so one of the things that we mentioned in the introduction to this session is that people have been providing leadership, trusted information, practical support, but making sure that community voices are being heard in the halls of power. And I think the point that you are making, I hope, is not lost on those who are in the audience today who have positions of influence or who can help determine the course of events. And I think what you're saying so clearly is that people of color who are doing the work need to be supported through our federal, in addition, also philanthropic points of view. And Absolutely. So I would just say again that so often it becomes so difficult to access those federal resources, always having to go through intermediaries and intermediaries as opposed to being directly plugged in. And I know that this is one of the lessons that you have been teaching.
Absolutely, Reed. People talk about now what happens after COVID when we go back to normal. We can't go back to normal because we died in normal. We will not go back. So right now, all people of goodwill, government agency, foundations, we're asking you to come to the table. We can help bring, the coalition that you co-founded. We can bring the people to the table that are out in the community doing the work. We know who's been successful. We see it, we feel it, we know the results. Come to us and we will sit down and put together resources for these things to work. And it's not a lot of resources, which is what kills me. It's not so much money that it's unattainable. It's actually people using their human resources more than their financial resources. But of course they need financial resources. You got to buy supplies. You got to get out there. You have to, you need money to get on the bus to go where you got to go when you're going into the projects. Come on.
Well, you have been fighting that fight. You've also been fighting alongside of people like Reverend Horace Sheffield, who we introduced earlier as the pastor at the New Destiny Christian Fellowship in Detroit. Can you talk a little bit about his work through your eyes, since he wasn't able to join us today?
Yes. Reverend Sheffield is the president of the Detroit Association of Black Organizations. That's 211 Black organizations in Detroit under his auspices. He brought them together as a coalition under the church to look at all of the social service needs and health disparities and health needs in the community of Detroit. Detroit has seen some very hard times. Reverend Sheffield has been a force in the community. And I mean like a wrecking ball force. He walks through and gets stuff done. I know that I can remember that we had an event for Choose Healthy Life, and he's one of the leading pastors of Choose Healthy Life. And we had an event, and at the event, we're at the church. We've got 400 and something people at the church. The mayor opened the stadium, Ford Stadium downtown, for everybody to come and get vaccinated. 50 people showed up. He told the cameras to pack up and let's go over to Reverend Sheffield's church and figure out what he's doing right so that we can replicate that. These are the kinds of ministers that we have in Choose Healthy Life. Reverend Butts and his ability to pick up the phone and call the governor in New York. Reverend Sharpton, who's got all kinds of abilities. Reverend Jefferson in Newark, New Jersey, who is Reverend Jefferson Esquire. He's a pastor. He's a lawyer. He's an executive from a major corporation. These are people who, again, we have what we need. We just need people to recognize that and support it.
One last thing, we have about 1 minute left in our conversation together. But you've mentioned this idea of health navigators in the church. Can you just give us a minute on what their role is and what they've been doing?
So we've professionalized that whole notion of having health ministries in the church. We've been able to fund these churches to hire somebody full-time. It is their full-time job to set up vaccination sites, to work with testing sites, to go out and do some community organizing so that there's a force multiplier and we can bring other people in the community to go out and give out the flyers and talk to the community and those kinds of things. They organize those kinds of events, health events where people will come into the church. They'll bring in the speakers. They're working with the NMA. These are the people that are on the ground that have created a workforce that is unbelievable. They have no misinformation. They are very, very clear. And they sound like me and look like me. So
there you go.
Taking no tea for the fever.
You are terrific. Deborah Fraser Howes, thank you so much. And we're so happy to honor you and Reverend Sheffield. Keep the work going. And again, from a policy point of view, this is the kind of work that needs to be supported. And we need to get ready for the next crises to come and the work of addressing the pre-existing disparities. So there's a lot more going on, and I certainly hope that it won't be as hard as it has been to get the resources to continue the fight. Thank you so much, Deborah. Take care.
God bless you, Reed. God bless you.
Bye-bye.